You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. We're talking about full mouth reconstruction today. According to my first guest, and she's been on the program before, your smile, your teeth and gums are never too bad to have the smile you've always wanted us. With us we have Las Vegas, we have Nevada's go-to prosthodontist, Dr. Nicole Mackie. Dr. Mackie, welcome to the program.
Thank you so much for having me.
Now, thanks for coming back, and you have a stack of photos, as always. Now, I'm not trying to side with you, but you know, we were talking in the green room. I mean, you're like one of the most experienced, especially for your age, and I know your age, you look about 10 years younger, but you're one of the most experienced, probably the most experienced for your age, for these complex cases, probably in the country. Is that fair to say?
I'd like to think so, and I really strive to be the best I can be. I had amazing training in New York. I grew up around my father, who was a dentist for 44 years. I was next to big pillars in our field, textbook writers, where I had a lot of great training. And then I worked for a large corporation where I did so many of these reconstructions a week that I just really had a passion and really honed in my skills. So I love what I do. I love to reconstruct and recreate someone's smile who's been going through, you know, different things, many variety of things. But yes, I've done now probably over 2,500 of these arches.
Wow.
And I really still love each and every one for its uniqueness and reasons why.
So you always knew you wanted to be a dentist? Like your dad, I mean, were you like 10 years old? You felt, I think I'm going to do this.
So my brother and I grew up going to dental conventions for our spring breaks.
Really?
Yeah. So I was very privileged to have such an amazing father who had such a passion for it, an uncle who's also another dental specialist. So I was never forced into it.
But you knew right away you wanted to do it.
I did, and he let me become an assistant in the beginning, and from there I just grew with him. And then as I started growing in my training and becoming a specialist, I would go to implant conventions with him, and it was very special for me.
So let's get right into it. Today's topic, full mouth reconstruction. Give us a working definition of like who's the typical patient that comes in where their mouth is really bad off. Their teeth.
Like how it sounds, full mouth reconstruction, the patient who's been to numerous of dental visits and places and every tooth is breaking down, or multiple teeth in the mouth are breaking down. Patients that have really bad bleeding, puffy gums that don't ever seem to get better, and they're told you need to come in every 3 months or this is never going to go away. Or my patients who have no teeth and are in dentures that are loosey-goosey and not staying in place.
Okay.
So many different reasons, congenital missing teeth, or just maybe an accident or medications. So just a lot of different reasons.
Now, as a prosthodontist, the prosthodontist in dentistry, that's the specialty that's really
the reconstructor of the mouth.
Like the cosmetic also, right?
Yes. So we hone in our skills on the materials used. We're big fans of technology, 3D imaging, and really understanding how everything fits together with the jawline, with the lips, the smile, how the top teeth meet the bottom teeth. It's an artistic component, it's architectural, it's precise, and it's made to be very detail-oriented to last a very long time, if not, sometimes I tell my patients till death do us part, but it's made to be for the long haul.
Because people don't like going to the dentist, right? They put it off and they put it off. Do you even still hear that?
I do.
They say, well, I mean, how do they say it to you? They say, no offense.
No offense, Dr. Mackie, I really don't like the dentist. And I usually ask them to give me a chance, but also I'll throw in a little joke. I'm a prosthodontist. So I tell them that hopefully, and it usually is, this is their last stop with me.
You win them over?
Yes, I do.
People that hated the dentist now like it.
Some people tell me that they were clenching onto the chairs and they come with me and they're flipping magazines or playing on their phone or watching TV or the movies I have in the rooms, and they want to hang out. My office manager jokes that our patients don't like to leave anymore. They like to make their coffee.
They don't like to leave.
They don't. They like it to be a hangout spot now. So
you have like this beautiful. Look, I've only seen it online, but it's big.
Yes,
I mean, you've got a training center. I mean, you've got everything going on over there.
We do. And
it's not expensive. That's another thing, and I know you wanted to bring that up. That because you do it all yourself.
Yes, we do it under one roof.
So it's less than using a bunch of people.
Yeah, so we're not going to also make the patient, drive from area to area for this little part or this little part or this imaging or the lab. I have taken everything and put it under one roof. The person who understands the way to construct the teeth is my lab technician. I will design it. I will understand and talk to the patient. What do you like? What don't you like? What do you want to see? I'm going to put their mouth in a mouth machine. I'm going to digitally design it so they're going to see their teeth even on a screen. And I have
that's
them.
Nice.
Yeah, and I even have them hold a mirror so they even see how their face and lips and everything is going to change. So I work on all of that.
So you could show them what it's going to look like beforehand.
Yes.
Rather than just a model that's outside of their mouth.
Exactly. With a mirror, it's very interactive.
Did they ever say, I want that?
Yes, they do. I have different photos and stuff, but sometimes they'll bring in photos from when they were younger. And maybe we want to have a little bit longer teeth if they had wear on their teeth or they really were grinding them away. So we want to give them their length back. We want to give them the brightness back and the vitality. They want to look younger again. They want to be happier and healthier and more confident.
So what would typically take, with this full mouth reconstruction topic,
yes,
typically you'd have to bring in a bunch of different specialists. But because you have training in those areas,
yes,
you can do it right there. And even if you're missing like just a couple of teeth or whatever, you also do dental implants.
Yes,
so you can
correct
pop in implants or give them implants.
Yes. So before you're a prosthodontist, you're a general dentist, and then I do my prosthodontic training, which is 3 years, and I get that degree, and actually it's a master's as well, and then another 2 years just to learn how to place that implant and to understand the bone and the gums, and then...
So is there that much to it?
Yeah, it really is. I mean, the mouth I like to think about as the heartbeat to the face. Yeah.
I mean, you're a dentist. It does not surprise me to hear that you think it's that important. How important is a smile, in your opinion?
It's very important. And you see people all the time, whether it be on Hollywood and movies or just in your daily life in passing. I mean, even pre-COVID, we go out to restaurants, we're eating, we're smiling, and we want to feel good when we're out to eat. We want to feel that we don't have to select the softest thing on the menu or have soup or run to the bathroom to soak our teeth really quick and put them back in to finish the date off. But then also you have people who get confidence from their smile. They are going for a job interview, and maybe you have two of the same credentialed people. They went to the same Ivy League school.
Like twin sisters.
Twin sisters went to the same Ivy League school. And one is a little bit self-conscious about a turned tooth, and one is smiling and happy and, shoulders back and just happy to be in that environment. The other one is drawn in. Who's the employer going to hire?
Yeah, the enthusiastic one.
The confident one.
Not necessarily the prettier smile, but if somebody is confident.
It doesn't matter that one sister's teeth are that much more perfect than another. It's the confidence that you get because you can radiate how you feel on the inside.
Do you see those changes? Like somebody comes in very shy or reserved, and then you fix their teeth, and they're different.
Absolutely. I see it the same day when I'm changing people's smiles. On reveal, day of surgery, when they're getting their new teeth, I hand them the mirror and instant reactions. I get tears of joy. I get disbelief. I get the feelings that people are restarting again.
Really?
Their new life is happening on that day. They are already planning in their head which restaurant they're going to go to. It's Vegas, the best restaurants in the world, the best chefs, which cruise that they want to take, which vacation they want to go on, which outfit that they've been looking online and scrolling through their phone.
So the most expensive part of this is all the going out and eating,
their clothes
traveling.
They're buying, their traveling bills,
Good for you.
Their food bills, everything like that is going to come after, but then they're living their true life. They're living their life again in a way that they've always wanted to live. They shed, the feeling of the unworthiness or not feeling good enough to go somewhere or anything where.
Is it true? I mean, at the top of the show, I say that your gums are never too bad to have a beautiful smile. But isn't it true if you have bad gums, can you even do some of this stuff?
Of course you can. In fact, that's one of the reasons why you should do it. The bad gums are coming from the bacteria on the teeth.
Okay.
Once we clean that out with a modality of procedures and get a fresh, clean slate and put either implants in or clean what was bad and put the new restoration there.
Like veneers or crowns or whatever.
Whatever it is, then they're living, then they're functioning. But
okay.
Yes, please come in if you have the bad gums because we want to get rid of that bad bacteria.
Yes. Okay, good. You brought photos. Let's jump into that. Good stuff.
Thank you. So here's Robert.
All right.
Robert is one of my younger patients, and he had numerous missing and failing teeth.
That's got to be unusual.
It's not. It's not because you're not a dentist, so you don't see it. And people are covered up either with the hand in front of the mouth or utilizing the mask for COVID. But you can't keep a mask on when you're out to dinner at a restaurant. So Robert had numerous failing, missing teeth, and the bacteria, different things from just years. And he came in and he wanted to be his true self again, confident. Get a better job, everything like that. So in one afternoon, here's good. Robert. And Robert is my selfie king. He sends me selfies. He sends his friends selfies. He's on social media, smiling, feeling good, healthy. Randy, I want you to look at his before picture.
Okay.
Would you say that he is potentially not taking care of himself?
Yeah, that's
not the case at all. He had a bacterial infection and numerous failing teeth where he just couldn't get in front of them. He couldn't get a hold of it.
So brushing and flossing is not going to fix it.
It's not going to cut it. He needed full mouth reconstruction. And with the modality of treatments, in one afternoon, we're able to change his life.
You told me over there, you said that they become more attractive. He's definitely more handsome.
Oh yeah, would you say he looks like the, young, handsome guy that you want to hire to work in a cool tech position?
Yeah.
Or whatever. So I'd like you to see this patient.
Okay.
Very lovely young lady. This is Shannon. Shannon came in.
Wow.
She didn't know what could be done for her. She photographs much younger than she is in real life as well. She couldn't eat. She was self-conscious. So
what do they say to you? Do they say what could be done? What's their fear? I mean, do they?
That she didn't want to be in a denture. She's too young and has too much going on for her life right now. She can't be in a denture. She's too cute.
Okay.
So in one afternoon for Shannon, we're able to change her life.
That's dramatic.
It's very dramatic. Not only does Shannon look, in my opinion, so cute even more, but she was actually given a promotion at work because her confidence was beaming. She is a new woman now. She came to my grand opening of my facility, dressed up, looking cute. I was like, whoa, Shannon.
That's good.
She looked amazing. She was so happy, and I'm so happy for her.
So it's more than just teeth.
It's more than just
Maybe
teeth.
I'm irritating you when we're in the green room and say, but it's just teeth. It's more than that.
It's more than just teeth.
And I think these pictures show it. So this was a combination of procedures, full mouth.
Yes.
Now you told me you're on a consult. They're telling you their hard luck story, but sometimes you get excited.
I get excited.
Elaborate on that.
I get excited because I can already envision what they're going to look like.
Really?
Yes. I can already see what they're going to be loving after we finish their teeth. I've done this so many times that I can already kind of understand too what people are going to ask for and what will fit their face. But yes, I already envision that. And I sometimes start smiling when someone is telling me these different things and they're like, why are you smiling? I'm like, because you're going to be helped. You're going to be changed.
So she shows up to the grand opening. She's different.
Oh, 100%.
Confidence. Good.
Able to eat whatever the fast food was. It was just great. Yep. Here's another patient.
All right.
Her name is Iman, and she is a beautiful person. She has a large family that she's been taking care of for years and years and years. She complained about sensitive teeth and then a lot of spaces through all the teeth where when she would talk, she would complain of even spitting when she talks. Also, She had bone loss, bone and gum loss, a congenital or genetic condition that as many times as you brush and floss, as many times as you get those uncomfortable scrapings, it's not going away. So she came to me and she told me about everything. So I, with her, designed a smile that she dreamt of always. And again, in one afternoon, we're able to achieve this.
Looks good.
Do you see how it follows her lip line and looks natural and really makes her look younger, correct?
Yes.
Does it make her look younger?
It does.
Happier?
Yes.
Healthier?
Yes.
That's the goal. She's very confident now. She's able to eat ice cream with her grandkids, all the things she couldn't do before.
Now, at your center, because you say that you just don't do one thing, that losing teeth, to quote you, is expensive. That if you could save teeth, you're going to do it.
If a patient has the ability to keep their existing teeth, but reconstruct it for health, for function, for beauty, aesthetics, and longevity, we'll do it. In fact, here's a patient who actually did a full mouth reconstruction on her existing teeth.
Okay.
Kim was very unhappy with her smile. She's a beauty guru. She loves aesthetics, cosmetics, but she didn't smile. She did not smile. She wanted to be her pizzazzy self, loving life. She travels a lot. So with a combination of procedures on some of her existing teeth, we were able to achieve this result. She's extremely happy. Her personality is showing through. She looks gorgeous.
Totally different person.
Would you say she looks younger?
Yes, for sure.
Would you say she looks happier?
Yes.
Healthier?
Yes.
Somebody that you would want to hang out with?
Yes.
Awesome. So with cleaning up her gums, some crowns, some veneers, we were able to achieve exactly what we wanted, what she wanted.
Is this the kind of thing where people say, or they have regrets where they say, I should have done this earlier?
The only regret that they have is that they wish they did it sooner. Let me show you the next patient who tells me this all the time.
Okay.
Here's my buddy Todd.
All right.
Todd's awesome. Todd is a very hardworking man. He is in a new relationship, newly married, and he started dating his current wife in this position. He did not want to continue this way.
Looks like he was missing teeth.
Yes, missing teeth, and he also had a lot of bad experiences from dentist to dentist, and just things didn't work out for him. So he came to me as a specialist, and he said, I don't like pain, I don't like these breaking down teeth, I have my new lady, and I really want to just be comfortable, healthy, happy. So here's also his before profile picture. He always used to tell me that his chin would stick out too much because his jaw was over closed.
So his mouth is kind of sunk in? Is that what I'm looking at?
Yes.
Okay.
And a lot of people tell me that they feel sunk in or their chin starts to become more witchy because they're losing the support that holds the skin and the chin back because they're losing their teeth.
Okay.
The teeth are the envelope that holds it.
Okay.
So now, with a combination of procedures, here's my buddy Todd.
He looks good. Well, I'm sure his fiance or his wife was thrilled about this. He looks like a different guy.
Oh my gosh, he looks amazing. He's so happy. He's feeling healthy. He's getting promotion after promotion with his work. He bought a new house. He is loving his life, and his wife is so supportive and so happy for him. They are the cutest couple together.
You know a lot about these patients.
You know, they're my family.
Because look, we've been doing this show for 25 years. And the doctors that come on the show, oftentimes they don't know anything about the patients. You know about their wife, you know about their dating situation. That's nice.
I do. I like to hear.
I'm not trying to side with you, by the way, but this is exciting with your energy.
Thank you.
Good.
I like to feel that if it were a doctor doing it on me, how would I want it to be done? Or if he was my brother or my father or my mother, how would I want them to be treated? And I really do need to understand where they're coming from, where they're going to give them the highest level of treatment.
Now, what's that profile? What am I looking at there?
This is his profile after we fixed his teeth.
Okay, let's take a look.
Now remember, before it was all sunken in. Now look at his chin, straight line jaw, nice profile.
Yeah. That's interesting.
Would you say he looks younger?
Yes.
Would you say he looks healthier?
Yes.
Happier?
Yeah. So the teeth just kind of support.
The teeth support the whole jaw. The whole jaw, the skin.
Did he expect this going in?
No, I don't think.
This was like a surprise.
Right. Because he came in saying, Doc, I want to eat. I want to smile and not, feel awkward. I don't want to have to wear dentures. And then the aesthetics came with Todd. let's do this contour. Let's do this contour. Let me wear a cool, outfit. Let me take care of my skin better.
I got to ask you this because you're a specialist. Does it cost a little bit more to go to a specialist? Because there's a lot of general dentists dabbling in this kind of work.
No, it does not.
Okay.
In fact, when a patient comes to me without having so much other work done by attempters, I'm sorry to say, I can do it one time the right way, with the right planning, the right measurements, the right details to get this done the proper way. So they don't have to keep redoing anything.
Now I'm going to rush you a little bit because I know you want to show all these photos.
Yes.
So we only have a couple of minutes left.
Okay, I have Steven here. Steven is awesome. Steven was very open with me, like you said, about getting to know each other. Steven wanted to date. Steven wanted to go out to dinner and not have to worry that his tooth was going to fall out into biting something. So he had a gum problem that made all the teeth super loose and didn't know what to do. He didn't want to wear dentures. He wants to go out with a girl and have a girlfriend and live his life. So Steven came to me and we planned out his new smile, new function, got rid of the bacterial disease, got healthier, and now here's Steven's after.
Looks good.
And that was also in one afternoon. So I want to show you how confident Steven was after the procedure. Now I'm going to tell you, this is the night of, he sent me this as a selfie. And I know he was just trying to show me his teeth, but just being himself, being his confident self, he sent me this photo.
Oh boy. Okay, so shirtless
Look at how handsome Steven is. He's going to get a bunch of girls. He's a great guy and he's very confident now. And
so you get this on your phone at night. That makes you feel good that a guy is happy with his appearance.
I was really honored and actually I felt privileged that he would feel that confident to show his doctor that just worked on his mouth for that day how he feels and looks.
Good.
Yes, it's amazing. I felt so great after seeing that.
Now, these are young patients, but you say that you have patients 70s, 80s, 90s.
96.
Like you have an older group of people.
Yeah, 96.
Why do they want to do this?
So my 96-year-old had a lot of life still left to live. She wanted to eat with her grandkids, and I asked her favorite restaurant, and she said it was P.F. Chang's, and she loves the walnut shrimp there. So she wanted to go eat her walnut shrimp at P.F. Chang's and still live her quality of life. The grandkids bring over cookies, they bring over food, social events, they're all built around eating and being with your family. And especially now, after this COVID or, what we've learned from COVID, it's about family. It's about human interaction that's meaningful. Cooking food together and enjoying those times.
So 70s, 80s, all the time in your practice?
All the time. That's actually the majority of mine.
Like a 70-plus crowd?
Yeah. Yeah,
but what if you're on medications? Because if you're 80, I think you're on 4 medications on the national average.
That's very true, of course. And in fact, it's probably one of the better reasons to do it because a lot of medications give dry mouth as a side effect. Dry mouth
is that right?
Breaks down teeth because you lose your saliva, which helps keep teeth more whole. There's a property in saliva that helps keep teeth a little bit better and washes away cavities. When you have a dry mouth, your teeth are more brittle. You don't have the saliva to help wash away, any bacteria. So patients who are on a lot of medications come to me all the time. And we're really, concerned about health and wellness. So in my detailed examination, I will understand every medication they're on, every health ailment, so that we're making,
you'll talk to their medical doctor
of course, clearances if needed. And we're doing everything for their utmost health so that this falls in line with them eating better, with them feeling better, with them, continuing on their health journey to have the highest quality of life.
Okay, then we should mention this.
Yes.
You're big on sedation. So most of these people, or just some of them, were
sleeping
IV sedated
while they were doing it.
So they're just relaxed.
Yes, IV sedation.
You say that they almost have no memory?
Some of them don't even remember what I did, or they're like, oh, that's it. And some of them say it doesn't even hurt. So we make them very comfortable. You still breathe on your own. It's an IV, but you're very comfortable.
And you can pull them out of it, you say?
Yes. It's the same
kind of... Is it better than the pill?
It is.
Okay.
The pill doesn't always work as good and it can fade faster, but this is a true anesthetic for dentists or prosthodontists and oral surgeons to utilize so patients can have this treatment done in a day or done in a way that they don't have to worry about any stress.
That's one of the advantages going to a specialist, right?
Yes, yes.
Because you guys do IV sedation.
Yes, and I have everything under one roof.
Do you think, because look, I've had dentists on the show and they say, well, all they need is a little nitrous or numbing. But
Not for doing a full mouth.
But do you think that's insensitive?
No, I mean, it can work here and there, but
insensitive
remember,
meaning the doctor doesn't get that, because nobody likes.
Or they're not trained to do it.
Okay.
Or they're not doing a full mouth reconstruction. I'm here
Which
to
takes
change
a little more time.
Yes, I'm here to change someone's entire mouth, their facial structures, the way that they are, the way that everything, functions. So it's better that they're comfortable.
Do you think this is more of an art than a science?
I think it's a hybrid.
Because you talk like this artist. Like almost like we're talking about beauty here.
Well, beauty is a passion of mine, and I feel that I am very creative, but I also understand the function and the science.
You don't act like a dentist, by the way. Does anybody ever say that?
Sometimes, yeah, they're like, oh, what do you do for work? And I tell them, and they're like, wait, so you do the marketing for them? I'm like, no.
You do the dentist. Well, good for you. We have time for one more.
Okay.
Sorry to rush you.
Here is Brian's before.
Okay.
Missing, failing teeth. Now, this just shows an example of how I'm designing his teeth with using facial machines, facial analyzers, mouth machines.
So this is a computer image
Yes.
of something that has not happened yet.
Yes.
Okay.
So we do it collaboratively with our patients to make sure that they're going to love what they get. And here you go. Here's Brian's after.
Yeah.
Brian doesn't really know how to smile yet. This is 2 seconds after I showed him the mirror of his brand new teeth. He never had this many teeth in his mouth. He never had a straight set of teeth that followed and contoured his lip line and came together in the proper manner. So he actually jokes with me. He's like, I'm practicing how to smile again in the mirror. So yeah, it's something really amazing for patients. It truly changes their life.
Now I have to bring this up because we get emails with questions about pricing and things. Medicare doesn't cover this. The best dental insurance covers like a small part. Of course, Medicaid and Medicare doesn't cover.
We have financing.
People are financing.
Yes, patients are financing what they need every day. We even have people in the office that are specializing just in helping a person understand all the different financing options.
Now, because you're a specialist, they don't need a referral to see you.
No.
They can just call you directly. Dr. Nicole Mackie.
Yes, Dr. Nicole Mackie.
You are kind of like the go-to person in Las Vegas.
Thank you. I'd like to think that. We have the premier center for full mouth reconstruction, dental implants, crowns, veneers, everything that you would want to get a full rehabilitation.
And it's affordable.
It's affordable. It's very comparable to anywhere else out there, but you're not redoing your work.
We're out of time, but somebody watching this, really bad teeth, really bad gums. If you had availability on your schedule, could they have their new smile maybe? If this is a Monday, they could have their new teeth on Friday.
Yes. So they just need one appointment with me to design everything and understand exactly who they are, what they want. And then the very next week, they can have their fixed brand new smile.
Okay, and with sedation?
With sedation if they want, which we do often. And not have to worry anymore. Be rid of a bacterial infection. Be rid of those broken teeth.
Okay, Dr. Mackie, I want to thank you for coming on the show. Incredible, great enthusiasm.
Thank you.
You got me excited about this, and these really photos are really, really good. So if somebody wants to learn more, they get to see you on the consult?
Yes, of course.
Okay.
Complimentary consultation.
Do they make an appointment online, or they call? Either way.
Both, yep.
Okay, good. Yeah. Thanks again.
Thank you so much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.